Hello, my name is Andy, Aesthetic Coordinator for Plastic Eye Surgery Associates. Thank you for choosing Plastic Eye Surgery Associates for your upcoming surgery. Your pre- and post-op instructions are very important for the outcome of your surgery. So today we're going to go through the instructions, and maybe this will help you get more prepared and maybe get rid of some of your jitters that you might have because you're thinking, oh my goodness, I'm having eye surgery. You will receive a surgery packet, and that will either be mailed to you or emailed to you. The important part of reading through this packet is it tells you what you need to do before surgery and how to care for yourself after surgery. When you come for surgery, make sure that you're ready. Make sure that you have all of your medications ready, all of your frozen peas ready, your warm compresses ready, and just have everything done so when you come for surgery, you can relax and take care of you after surgery. The day of surgery, make sure you wear comfortable clothing because what you come in is what you have surgery in. So wear your most comfortable clothing. You can wear slip-on shoes or tie shoes. If you have long hair, please make sure that you bring a cloth headband with you when you come. If you would like to listen to your own music with some earbuds, that's fine. Make sure your earbuds are low profile. If you like, you can bring some dark glasses with you. All of your prescriptions will be called into your pharmacy 1 to 2 weeks before surgery. If you are given Valium or Tramadol or Norco, please wait a few days before you pick them up. Those prescriptions will need an extra authorization that may take a few days, and it could save you an extra trip to the pharmacy. You will receive a reminder call concerning your surgery a few days before surgery. We just want to check in with you to see if you have any questions, if you have any concerns. Also remember that you have to have a driver. That's really important. You're not going to be able to drive home. Your vision will likely be very blurry after surgery, which is normal, so you're not able to drive. At the back of the packet, you will notice several pages of medications and supplements that you should avoid 1 to 3 weeks prior to surgery. There may be some medications that you're taking that you don't even think contains things that could thin out your blood and cause more bruising. You may be taking vitamins that may have ingredients in them that you don't even think about that may also cause extra bleeding and bruising. If you're having a local anesthetic, there are no dietary restrictions. Go ahead and have breakfast, lunch, you can have coffee, whatever you choose to do, there are no restrictions. In the day of surgery, make sure that you take your medications accordingly if you're having a local anesthetic. If, however, you're having monitored anesthesia care, or what's also called MAC, please pay attention to your instructions. We want you to have a very good breakfast 8 hours prior to surgery because it's going to be a long day, as most of our MAC cases are scheduled around 2:30 in the afternoon. Make sure that you've hydrated yourself very well the days prior to your surgery, and then that morning after your 8-hour period, you cannot have anything to eat or drink, including water, after that. When you come for surgery for a MAC anesthesia, make sure that your top is very loose fitting because we'll need to be able to put some leads under your top. And so if it's loose fitting, it makes it easier. If you have maybe a 3/4 length sleeve or a short sleeve shirt so that we can get the IV started for you. Also bring all your medications or a list of your medications for the anesthesiologist. After surgery, this is where your part really comes in as well. You're going to have bruising and swelling that could last anywhere from 1 to 3 weeks. Sometimes it can last a little longer, just depending on the patient. The most important thing that you can do to help with your swelling is frozen peas. We love frozen peas for many reasons, but one of the reasons is they fit very, very well into the orbit of the eye. And that's where we really want the cold compress to come in handy to get right to that area to help reduce the amount of swelling that you have. So a 2-pound bag of frozen peas will make 8 to 9 snack-sized baggies. When you get your bag of frozen peas, make sure that there's no clusters or clumps of frozen peas in it. Pour it into a bowl, and you can take a 1/2 cup measuring cup to make it easier to fill your baggie. When you fill your baggie, you want to make sure you have a nice layer of frozen peas. When you take your baggie out of the freezer, you're going to take a 1/2 sheet of paper towel. A thicker paper towel may be better for you because sometimes it can feel pretty chilly. So take a 1/2 sheet of paper towel, and you're going to roll your frozen peas in the paper towel. You're going to take a spray bottle and you're going to spray the top of it. Get it nice and damp. And what that does is it penetrates that chill deeper and gets right to where we want it to be to really help control some of that swelling. So then you'll pinch it in the middle like a bow tie, or you can take it and flick it like this, so this part will fit over your nose. And then you just simply put it on your eyes like this, and then you'll see one will fit over both of your eyes. And then we will give you a headband to hold it in place. The headband will hold it in place and also form some compression, which will be very important for the swelling as well. During the day, you're going to be as consistent as you possibly can. That means you're going to put them on in 20 to 30 minutes. They're going to thaw. You're going to throw away the paper towel, put the peas back in the freezer and lay them flat, grab another bag of peas and repeat the process. It's going to be consistent and not 20 minutes on and 20 minutes off. We want it consistent, so one right after the other. You will get far more benefit from it that way. If you need to take them off to switch them out, to use the restroom, to get something to eat, that is fine, but the consistency is what we are looking for. At bedtime, this is very important for compression and protection. If you wake up in the middle of the night, feel free to switch it out. If you sleep all night, fabulous, you have some great sleep. So when you get up in the morning, you're going to have more swelling on day 2 and day 3, so make sure you get right back onto those cold compresses again as consistently as you possibly can. One helpful hint also during cold compresses is audiobooks. Audiobooks really help to pass the time, and getting up and switching out your own compresses also is very important because it helps you get moving around a little bit and it kind of passes time as well. But now we are going to start with the warm compresses. The warm compresses will break down the bruising or help reduce some of the bruising. And what you'll do, and the instructions are going to be in your packet, you're going to take a sock, a 70 to 80% cotton sock, and you're going to fill it with 2 to 3 cups of raw rice. You'll tie it at the end with a piece of string. After you have made your warm compress, you're going to put it in the microwave. And the range of time will depend on your microwave and the wattage of your microwave. It might be 40 seconds, it might be 60 seconds. You're just going to have to try to play around with it and see what's best for you. When you put your warm compress in the microwave, make sure you put it on the glass plate. When you take it out, you're going to rub it very, very well because this is going to heat from the inside out, and we want to make sure there's no hot spots that can burn your skin. Then you're going to take a half a sheet of paper towel and you'll roll it up. And again, you're going to take your spray bottle and you're going to spray it down nice and damp. And then you'll just pinch it in the middle and you'll put it on your eyes. This will be heavy enough that you won't need to use a headband, and this will go on your eyes for about 10 to 15 minutes or until it cools off. If you put it on your eyes and you're thinking, ooh, that's pretty warm, then it probably is too warm, so take it off, let it cool off a little bit, and then put it back on again. We certainly don't want you to burn the bridge of your nose or underneath your eyes because your warm compress is too warm. The warm compresses you're going to use once an hour for 10 to 15 minutes, 8 to 10 times a day until the bruising is gone. So you'll be the gauge of how long you'll need to use that. After surgery, sleeping is going to be important in how you sleep. We want you to sleep with your head elevated for 2 to 3 days. That could be if you have an adjustable bed, you can raise your bed. If you need to wedge up some pillows to make a nice angle for you, you can do that. If you're a side sleeper, a travel pillow that you can put around your neck works really well, or pillows along the side, so if you happen to roll over, you'll wake up and catch yourself. And please try not to sleep on your side for 3 to 4 days. And for us side sleepers, that's kind of hard to do, but it's well worth the wait. Also, there will be some exercise and weight restrictions with your surgery. No rigorous exercise for 2 weeks. No bending from the waist or lifting 10 pounds for 2 weeks as well. And if you are a contact lens wearer, make sure that you have glasses on hand because the contact lens can be resumed in 3 weeks. If you're having surgery and you're not giving any pain medication, Tylenol is perfectly fine to use if you have any discomfort. If you have discomfort and Tylenol is not helping and you have concerns, feel free to call our office. Your sutures will come out in 7 days, so you will come back for follow-up between 7 and 8 days to our office. That appointment you may drive yourself if you would like to, and it will take about a half an hour. At that time, we'll give you our next set of instructions and answer any questions that you may have. Makeup you may resume 3 days after your sutures are removed, but be so careful when you take off your makeup. Try not to rub very hard and just be really gentle. Eyelid tissue is very delicate and it's going to take up to 3 weeks for it to heal up entirely. So be very, very careful when you're doing that. And we ask also that you don't have any alcoholic beverages while you're taking any of the medications that you're on. Eye drops. Eye drops can be very important during this time because often you'll find that your eyes are a little bit dry after surgery. And that's pretty normal because you're not blinking as much as you're used to blinking. You have cold compresses on, then you have warm compresses on. So there's just a lot going on. Preservative-free is our choice because there's less likely that you'll have any problems with them. So a preservative-free lubricating eye drop on hand, and you can use them as frequently as you need to. Bathing. After surgery, most people will wait a day or two before they take a shower simply because they're hanging out with frozen peas and they're just resting. When you're ready to take your shower, that's totally fine if your eyes get wet. Just pat them dry. Make sure, however, that that shower head is coming from behind your head and not in your face or around your eyes, because as I said, that skin is very, very, very delicate. You will find that each week after your surgery, your eyes are going to change. With the healing process, they change weekly. So you're going to see big changes in the first to 2 to 3 to 4 weeks. When your sutures are removed, your incisions might be a little lumpy, bumpy, but don't worry, it's going to smooth out. The peakness is going to keep fading and it's going to go to a very fine, fine white line. This is all part of the healing process. And remember, you just had surgery and it doesn't happen overnight. It is a process. But it will look really good in about 3 months, and then you'll be so happy that you're all through that process and you will be loving your new eyes. Finally, if you have any questions, feel free to call our office. It's really important that you don't sit at home and go, oh, I wonder if I should. Just call our main number at 713-795-0705, and we will be happy to answer any questions that you may have. If after hours you have questions or concerns, feel free to call our office at the same number, the main number, at 713-795-0705, and you will get the on-call doctor. I hope that this information has been helpful for you, and if at any point you have any questions, as I said before, feel free to call our office. We'd be more than happy to help you. Thank you.